Do you feel tired all the time? A deep-seated exhaustion that no amount of sleep seems to fix? Are you constantly thirsty, reaching for glass after glass of water, yet never feeling truly quenched? Maybe you're running to the bathroom more than usual, an interruption that's become a new, unwelcome normal. These things might seem like minor annoyances, just the background noise of a busy life. But I want you to pause and listen closely, because your body could be sounding a silent alarm, one that's easy to ignore until it's too late. This isn't just about feeling off, it could be the first whisper of a much larger health issue. Diabetes isn't just a sugar problem or something you only need to think about after a big meal. It's a full-body threat, a condition that, when left unchecked, wages a quiet war on your entire system. This is a disease that doesn't just stay in your bloodstream, it travels everywhere, from the delicate vessels in your eyes to the intricate filters of your kidneys and the sensitive nerves in your hands and feet. If ignored, the damage can be catastrophic, leading to blindness, kidney failure, nerve damage, and it can even take your life. The stakes are incredibly high, but the power to change the outcome is in your hands, starting with knowledge. That's why we're here today. In this video, I'm going to break down exactly what diabetes is, explore the critical warning signs your body is sending you, uncover what causes it, and most importantly, discuss how you can fight it. We'll cut through the medical jargon and get to the heart of the matter in a simple, clear way that's easy to understand. This isn't just another health video, this is a conversation that could literally save your life or the life of someone you love. So let's get started. So what exactly is diabetes? At its core, it's a story about energy. Every single cell in your body, from your brain to your muscles, needs fuel to function, and that fuel is a type of sugar called glucose. We get glucose from the food we eat. Think of it like gasoline for a car. But just having gasoline in the tank isn't enough. You need a key to turn on the engine. In your body, that key is a hormone called insulin. Insulin is produced by your pancreas, and its job is to unlock your cells, allowing glucose from your bloodstream to enter and be used for energy. It's a beautifully precise system designed to keep your body running smoothly and your energy levels stable. Now imagine that system breaks down. In diabetes, this is precisely what happens. Either your body doesn't produce enough insulin, or any at all, or the cells in your body stop responding to the insulin that is being produced. It's like having a key that's broken, or a lock that's jammed. When this occurs, the glucose can't get into your cells to be used as fuel. Instead, it gets stuck in your bloodstream, building up to dangerously high levels. This is what we call high blood sugar, or hyperglycemia. Your cells are literally starving for energy, even though there's an abundance of fuel floating right outside their door. This traffic jam of sugar in your blood is what causes all the problems. It's not just that your cells are starved for energy, which leads to that profound fatigue I mentioned earlier. This excess sugar acts like a slow-acting poison, damaging the blood vessels and nerves throughout your entire body over time. It's a chronic condition, meaning it's long-lasting and requires ongoing medical attention. Understanding this fundamental process, the role of glucose as fuel and insulin as the key, is the first and most critical step in understanding how to manage and combat this disease effectively. It all starts at the cellular level. When we talk about diabetes, it's crucial to understand that it's not a single entity. There are several types, but we're going to focus on the three main ones: type 1, type 2, and gestational diabetes. Each has a different cause and affects the body in a unique way. First, let's talk about type 1. Think of this as an autoimmune condition. For reasons we don't fully understand, the body's own immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means the body produces very little or no insulin at all. It's like the factory that makes the keys has been shut down permanently. Type 1 diabetes often develops in childhood or young adulthood, and it has nothing to do with lifestyle. These individuals must take insulin every day to survive. Next is the most common form, type 2 diabetes, which accounts for about 90 to 95% of all cases. In type 2, the story is different. The pancreas usually produces some insulin, at least initially, but the body's cells don't use it effectively. This is a condition known as insulin resistance. It's as if the locks on your cells have become rusty and the key no longer fits properly. To compensate, the pancreas works overtime, trying to produce more and more insulin to force the cells to open. Eventually, the pancreas can't keep up, and blood sugar levels rise. type 2 diabetes typically develops in adults, though we are now seeing it more and more in younger people. And it is strongly linked to lifestyle factors like obesity and inactivity. Finally, there's gestational diabetes. As the name suggests, this type occurs during pregnancy and usually resolves after the baby is born. During pregnancy, the body produces hormones that can make cells more resistant to insulin. For some women, their pancreas can't produce enough extra insulin to overcome this resistance, leading to high blood sugar. While it is temporary, having gestational diabetes puts both the mother and the child at a higher risk for developing type 2 diabetes later in life. It serves as an important warning sign, a preview of a potential future health challenge that needs to be taken seriously. Understanding which type we're dealing with is fundamental to proper treatment. So, what causes someone to develop diabetes? The answer is complex, a combination of factors you can't control, and, importantly, many that you can. Let's start with the non-modifiable risk factors, the things you're born with. Family history plays a significant role. If you have a parent or sibling with diabetes, your own risk increases substantially. It's a genetic predisposition that's passed down through generations. Your ethnicity can also be a factor. People of certain backgrounds, including African American, Hispanic, American Indian, and Asian American, have a higher statistical risk. And of course, age is a factor. The older you get, the higher your risk becomes for developing type 2 diabetes. These are the cards you've been dealt. But now let's talk about the modifiable risk factors, because this is where you have the power to change your story. The single greatest risk factor for type 2 diabetes is being overweight or obese. Excess body fat, especially around the abdomen, increases insulin resistance, making it harder for your body to use insulin effectively. This is directly linked to two other major risk factors: a poor diet and physical inactivity. A diet high in processed foods, sugary drinks, and unhealthy fats puts a tremendous strain on your body's metabolic system. When combined with a sedentary lifestyle, spending most of your day sitting, it creates the perfect storm for developing insulin resistance. There are other important factors to consider as well. Having high blood pressure or hypertension is often linked with diabetes, as both conditions can damage your blood vessels. Similarly, having abnormal cholesterol levels, specifically low levels of good HDL cholesterol and high levels of triglycerides, increases your risk. And we can't forget the impact of chronic stress and poor sleep. When you're constantly stressed or sleep deprived, your body releases hormones that can raise blood sugar levels and promote insulin resistance. It's a web of interconnected factors, and addressing any one of them can have a positive ripple effect on your overall risk. One of the most dangerous things about diabetes is that its early symptoms can be, well, pretty subtle, easy to dismiss as just being tired or stressed. But these are not random feelings, they're actually biological signals. They are, you could say, the whispers before the roar. One of the most classic signs is excessive thirst, which is called polydipsia. Because there's so much sugar in your blood, your kidneys go into overdrive trying to filter it out. This process pulls a lot of water from your body, leaving you dehydrated and constantly thirsty, no matter how much you drink. This directly leads to the next sign: frequent urination, or polyuria. You might find yourself running to the bathroom more often, even waking up at night because your body is trying desperately to get rid of that excess sugar. Another key sign is persistent, unexplained fatigue. Remember, your cells are being starved of the glucose they need for energy. Even though your bloodstream is full of fuel, it can't actually get to where it's needed. The result is a profound sense of exhaustion that just doesn't go away with rest. You might also experience unexplained weight loss, which can seem confusing. This happens because, without enough insulin to help your body use glucose, it starts breaking down muscle and fat for energy instead. So you're losing weight, but not in a healthy way. Your body is essentially consuming itself for fuel. Other warning signs can be more specific. Blurred vision is a common complaint. High blood sugar can cause the lens of your eye to swell, which changes your ability to focus. You might also notice that cuts and sores are taking much longer to heal than they used to. This is because high blood sugar impairs your body's natural healing processes and can damage your circulation. Finally, pay attention to any tingling, pain, or numbness in your hands or feet. This is a sign of nerve damage, or neuropathy, which is a direct result of sugar damaging your delicate nerve fibers. If you are experiencing two or more of these symptoms consistently, please do not ignore them. It is a clear signal to see your doctor and get tested. Ignoring the warning signs of diabetes or failing to manage the condition properly comes with a devastatingly high price. The chronic high blood sugar we've been talking about doesn't just make you feel unwell in the short term. Over years, it systematically destroys your body from the inside out. Let's start with your heart and blood vessels. Diabetes dramatically increases your risk of heart disease and stroke, which are the leading causes of death for people with diabetes. The excess sugar damages the lining of your arteries, making them hard and narrow, a condition known as atherosclerosis. This can lead to high blood pressure, heart attacks, and strokes. It turns your circulatory system into a high-risk zone. Next, let's look at your kidneys. These remarkable organs filter waste from your blood, but the constant effort of filtering out excess sugar puts them under immense strain. Over time, this can lead to diabetic nephropathy or kidney disease. The tiny filtering units in the kidneys get damaged and begin to leak protein. In its final stages, this leads to complete kidney failure, a condition that requires either regular, time-consuming dialysis or a kidney transplant to survive. It's a slow, silent destruction of one of your body's most vital systems. Similarly, your eyes are at extreme risk. The small blood vessels in the retina can be damaged by high blood sugar, a condition called diabetic retinopathy, which is a leading cause of blindness in adults. The damage doesn't stop there. As we mentioned, nerve damage or neuropathy is a major complication. It often starts as tingling or numbness in the feet and can progress to a complete loss of sensation. This is incredibly dangerous because you might not feel a cut, blister, or sore on your foot. Combined with poor circulation and slow healing, these minor injuries can become severe infections or ulcers, sometimes requiring amputation of a toe, foot, or even a leg. Furthermore, diabetes can lead to sexual dysfunction in both men and women, and recent research has shown a strong link between diabetes and an increased risk of cognitive decline, including dementia and Alzheimer's disease. The message is clear: inaction is not an option. Hearing about all these potential complications can be frightening, but here's the most important message I can share with you. You have the power to fight back. Diabetes management is a proactive, lifelong commitment, and it's built on a foundation of knowledge and consistent action. Treatment isn't just about a single pill. It's a comprehensive approach that puts you in the driver's seat of your own health. The cornerstone of managing diabetes, especially type 2, is lifestyle changes. This starts with what you put on your plate. A healthy eating plan is not about deprivation. It's about making smart, balanced choices. Focus on whole foods, fruits, vegetables, lean proteins, and whole grains, while limiting processed foods, sugary drinks, and unhealthy fats. Hand in hand with diet is physical activity. Exercise is medicine when it comes to diabetes. It makes your cells more sensitive to insulin, which helps your body use glucose more effectively and lowers your blood sugar. Aim for at least 30 minutes of moderate activity, like brisk walking, most days of the week. This, combined with a healthy diet, is the most effective way to achieve and maintain a healthy weight, which is critical for controlling diabetes. Even a modest weight loss of 5 to 10% of your body weight can have a profound impact on your blood sugar levels and overall health. It's about creating sustainable habits, not a temporary fix. Of course, for many people, lifestyle changes alone aren't enough, and that's where medical treatments come in. This can include oral medications that help your body produce more insulin or use it more effectively. For people with type 1 diabetes and some with advanced type 2, insulin therapy via injections or an insulin pump is essential for survival. A crucial part of any treatment plan is regular monitoring. This means checking your blood sugar levels at home as directed by your doctor. This data is vital. It tells you how your diet, exercise, and medication are affecting your body, allowing you and your doctor to make adjustments. Regular doctor visits are non-negotiable. They are your partner in this journey, helping you to stay on track and prevent complications. We've talked a lot about managing diabetes, but what if we could stop it before it even starts? For type 1 diabetes, which is an autoimmune disease, we don't yet have a way to prevent it. But for type 2 diabetes, the story is completely different and incredibly hopeful. The overwhelming scientific evidence shows that type 2 diabetes is, in most cases, a preventable disease. This is a powerful truth. You are not destined to get it, even if you have risk factors. You can significantly delay its onset or even prevent it entirely by making healthy choices, starting today. It's about being proactive rather than reactive with your health. The power is truly in your hands. The strategy for prevention looks very similar to the strategy for management, which shows just how effective these lifestyle habits are. The number one goal is weight management. If you are overweight, losing even a small amount of weight can cut your risk for developing type 2 diabetes by more than half. This is one of the most impactful things you can do. The key to that weight management is, again, a healthy diet and regular exercise. Ditch the sugary sodas and processed snacks. Fill your plate with nutrient-dense foods that fuel your body properly. And find a physical activity you enjoy, so it becomes a part of your life, not a chore. It doesn't have to be a marathon. A consistent daily walk can work wonders. Finally, don't underestimate the importance of other lifestyle factors. Prioritize getting enough quality sleep. Aim for 7 to 8 hours a night. Chronic sleep deprivation can wreck your hormones and your blood sugar control. Find healthy ways to manage your stress, whether it's through meditation, yoga, hobbies, or spending time in nature. And perhaps most importantly, get regular checkups with your doctor. Know your numbers, your blood pressure, your cholesterol, and your blood sugar. An A1C test can tell you your average blood sugar over the past few months and can detect prediabetes, the stage before full-blown diabetes. Catching it at this stage gives you a golden opportunity to turn things around before any permanent damage is done. Prevention is your best medicine. As we've seen today, a diabetes diagnosis is not a life sentence. It's a call to action. It's a serious condition, yes, but it does not have to control your life. You have the power to manage it, to live a life that is strong, healthy, and full of the energy you deserve. The key is to act early and to be consistent. Every healthy meal you choose, every walk you take, every time you check your blood sugar, it's an investment in your own future. It's a declaration that you are in control of your health, not the other way around. Don't let fear paralyze you. Let knowledge empower you. The most important takeaway from our time together is this: listen to your body. It communicates with you every single day. That persistent thirst, the constant fatigue, the unexplained changes, those are not things to be brushed aside. The signs are there for a reason, and it is crucial that you do not ignore them. Acknowledging these symptoms and seeking help is not a sign of weakness. It is a profound act of strength and self-care. You owe it to yourself and to the people who love you to pay attention and take that first step, which is often the hardest one. Remember, the journey to health begins with a single decision. Whether you're looking to prevent diabetes or manage an existing diagnosis, the path forward is clear. It's paved with better choices, consistent habits, and a partnership with your healthcare team. The best treatment for any disease is always prevention, and there is no better time to start protecting your health than right now. Your future self will thank you for the choices you make today. Thank you for watching. Be well.